Word of the day, doctor, mini mold. If you don't know mini mold, let me introduce it to you. Mini mold is an absolutely fantastic little selection of things that you can make for your patient in the mouth, and you can apply a hook, a bracket, a bite turbo, a bite ramp, so many things that you can apply with the mini mold to change things and make it easier for you and your patient. Now, a mini mold comes with a little handle in which you insert the mold, which are plastic. They are a very soft, maybe they're silicone actually, I'm not sure. And they are soft, and so you insert the mold into the little handle. The handle is like a sealant brush handle. And you put that mold in there, and then you fill it with any composite you like. I like to use my Banlock to do that. And you fill it up. You have etched and prepared the tooth. You lay the mini mold onto the patient's tooth, lay cure right through the little mold, the silicone or plastic mold, and pop it off, the mold off, and there you have remaining in the patient's mouth on their tooth whatever you wanted to have. For example, let's say you have trauma. Let's say you have a patient come in with trauma. They have luxated an upper incisor, and it needs to have a 1 or 2 week sectional wire placed. And you could place the wire and plop a big chunk of composite on it if you wanted to. Or you could just put a little bracket on it and the adjacent 2 teeth or 3 or 4, whatever teeth you feel like you want. With the mini mold, you can make a bracket. You can lay the wire in the bracket. Then, instead of having the wire attached to the tooth with composite that you've got to pop off to remove the wire in a couple of weeks, further traumatizing the tooth, you can quickly, easily, and gently remove the wire from the brackets and leave the brackets in place until you're ready to remove them so that that tooth has healed more before you do that. Okay, that's one use. Love that one. Another use is for bite turbos on posterior teeth. A little glop of plastic in a nice little shape right where you want it. Perfect. Another is a hook on the upper lingual, let's say, and the lower buccal to correct a posterior lingual crossbite of just the 6s, either at the end of treatment or post-treatment, whatever may happen. Let's say the 7s come in, the 12-year molars come in a little bit of a edge-to-edge or lingual crossbite, and you don't have braces on them. Put a little hook on the lingual of the upper, a little hook on the labial of the lower, and start a cross elastic. You'll correct it very quickly. So those are some of the uses for the mini mold. I wouldn't want to practice without a mini mold. Go to ArthoArch Company and find out how to get one. It comes in a kit. You can specify which molds you want. If you happen to use ethylene oxide gas sterilization, you can reuse them. If you don't, they are disposable. So up to you how you sterilize, but that is one way not to have to replace every single disposable item that you use with patients. So those are some thoughts for today. Mini mold, check it out. If you don't have it already, it might be something to consider. Dr. Chris, signing off.